Hello, my name is Morgan. I am a registered dietitian, and welcome to the virtual pre-operations class for your bariatric surgery.
Hi guys, welcome to Foothill Regional Bariatric Program. I hope you guys have completed most of the requirement by the time you're watching this video. If not, go ahead and do it. We have a great and a very supportive team here from the initial welcome calls to the involvement of the dietitian, bariatric coordinator, the physical therapy, and an army of nurses are here waiting to be honored to take part in your care. The purpose here is eventually to have the great outcome for you, throughout this journey from the start to the end. The experience and the quality of the care is all we focus here. Our purpose is not just to operate and have a surgery done. Our purpose is to have patients guided from the start of the journey till the end of the journey to acquire the ultimate experience and best possible outcome and help them get rid of all the health issues they have and help them get rid of all the extra weight they have. So hopefully your journey will be remarkable and a good experience with all of us. Thank you for the opportunity to be involved in your care, and I look forward to see you with my team. Thank you. Hi guys.
All right, now we are going to be talking about the pre-operation diet, and you will likely be following this now based off of your physician's recommendation. It's typically 1 to 2 weeks before the surgery. So you're doing 3 protein shakes a day, and this can be the Premier Protein, Ensure Max, Boost Max. They're all around 30 grams of protein and low sugar. You can do sugar-free beverages like Crystal Light, soup broth, Gatorade Zero. Your surgeon may allow vegetables raw or steamed. Again, these are plain. We're not adding any fats like butters or oils to them at this stage. And sugar-free, fat-free yogurt. So shakes, sugar-free beverages, vegetables, and yogurt, depending on if your surgeon has stated those to you. Once you hit the day before surgery, just the clear liquid. So they have to be see-through. No more shakes or vegetables or yogurt. And then at midnight, the night before surgery, nothing by mouth. No food, no fluid, no water, nothing at all. Make sure you have your multivitamins and minerals purchased before your procedure so that way they're ready for you. You can utilize a clear protein drink even on your clear liquid day, the day before surgery. So something like Premier Clear or Gatorade Zero that's clear. You can use these to help curb your appetite that day before surgery, as well as you can use them after surgery as well for a little extra protein boost. Again, for women, we're aiming for 64 ounces of total fluids, and for men, 96 ounces of total fluids. Okay, again, on our clear liquid day, you will be taking milk of magnesium at the dose given by your surgeon. So look through the paperwork or the email he sent you on that. It can be any brand, but it does have to be milk of magnesium. Make sure you're getting in plenty of fluids on this day because you cannot, you will likely be dehydrated after this bowel cleanse effect the milk of magnesium does. So make sure that you are super hydrated, maybe even adding in an electrolyte beverage as long as it's sugar-free, like a sugar-free Gatorade or a sugar-free Powerade. After the procedure, the first thing we will have you start on will be those sugar-free clear liquids again. So likely some water and some broth. You will be taking 1 ounce sip every 10 to 15 minutes all day long. No straws, no caffeine, no carbonation. Once you get home from the hospital, you will start on those protein shakes, and you're aiming for 2 to 3 shakes a day. Now 3 is ideal, but if you can only tolerate 2, then that is a good place to start. Get up and walk around once you are cleared to do so, because this will help to push out some of the pressure and some of the discomfort that we likely see after the surgery. It is super important that for both before and after the surgery, you are staying nice and hydrated, really aiming for that 64 ounces or 8 cups of fluids between your protein shakes and other approved beverages like non-fat milk, unsweetened soy milk, Crystal Light, water, and those multivitamins. You will start taking those again 5 days after surgery. You have 3 weeks of the liquid diet, so the shakes, other beverages, and then on day 5, that's when you start those vitamins. After the procedure, you will have another nutrition visit with Mary. She is our other dietitian, and she will cover the soft and eventually the solid food diet. You should be receiving a phone call to you about the day of surgery from the pre-operation department. They will tell you about your arrival time or any additional testing that you may have to do. So if you haven't heard from them a few days prior to your surgery, you can always contact them at the number below and ask for the pre-op nursing unit. If they have you come in for additional pre-operation testing, they may send you home with this chlorhexidine solution, and you basically are going to shower with this the night before. Now, if they don't give you this, that's okay, and if you do a little spot test on your hand and you have any sort of reaction, do not use it. You will still be fine. It's just one last good clean before the surgery. The day of the surgery, you will come into the main hospital lobby and just tell them that you're there for your surgery. They will send you where you need to go. Remember, you are not eating anything or drinking anything after midnight, so no gum or liquids in the morning of your surgery as well. You can brush your teeth, just don't drink the water after the fact. A couple things to remember before coming in for your surgery is that for visitors, you can only have 2 people at a time. The hours are from 9 a.m. to 9 p.m. Kids must be over the age of 16, so if you have any little ones, they will not be able to visit you in the hospital. We do not allow overnight stays. Make sure that you come in loose-fitting, comfortable clothing, as well as leave any valuables at home just to decrease the risk of them getting lost. Now we are going to talk about what happens after the surgery. So some pain after the surgery is to be expected. It should be around a 4 to 5 out of 10. If you're at a 10 out of 10, definitely check in with your surgeon. Even though this is a laparoscopic surgery, we are still cutting through your stomach muscle, which can result in some pain and discomfort. And taking your pain medications as well as walking on flat surfaces are the best way to try and reduce the pain level.
After every weight loss surgery, all bariatric surgeons recommend to have an abdominal binder, which is something like that. Today, we're going to demonstrate how exactly you have to use it. If you have no help available, how can you still use it as the patient yourself? So the good technique is very important. The purpose is to give you comfort, less pain, ability to ambulate better, ability to take stairs better, and you feel like almost somebody's hugging you. So let's see if I can demonstrate better and make things easier for you. So you grab the binder, you basically 2 arms, 2 hands that are needed. So the sticky part is on the right side, and you grab it, put it around. There we go. Goes around you. And then both hands. So both hands go around. The left hand works the most. You stretch it, push it down, put it down, and then you just stick it in, cover. That's it. You're done. Under the rib, not on the breast, not on the thighs. This is the area that is more sore and needs comfort and support, which abdominal binder provides and makes your life very easy. You're able to ambulate much, much better and with a lot of comfort. So continue to wear it. Usually we recommend it for up to 2 weeks. I recommend it mostly when you're walking, not when you're sleeping. Otherwise, you can't even breathe. So just keep in mind. Hopefully this will help. Thank you. Sure, every
Dehydration is the #1 reason that we see patients readmit to the hospital, so we really want to prioritize you staying nice and hydrated. 1 sip of fluid every 10 to 15 minutes, whether that's water, broth, protein supplements, or other sugar-free beverages. Make sure you are always sipping on something. Again, remember walking on flat surfaces helps to reduce some of the pressure and pain that we see after the procedure, as well as can help to reduce blood clots. Constipation after surgery is extremely common due to a variety of changes, like being on pain medication, changes in diet, less fiber, less movement. So we do recommend buying some Miralax and having that on hand. Now this is something you can get over the counter, and I would try that for a few days before checking in with the surgeon. He may have you try something a little bit stronger, but the Miralax is a good place to start. So strongly recommend buying this before your procedure. In regards to discharge planning, you will be on pain medication when you leave the hospital, so you will need a ride home from a friend or family member, so make sure you have that planned. Additionally, before you come to the hospital, make sure you've done your grocery shopping, filled your prescriptions, purchased your Miralax, and gotten your protein shakes ahead of time to make your life easier. And if you are diabetic and checking your blood sugar, as well as if you use sleep apnea equipment, please bring that with you to the facility. So, like I said, you will not be able to drive. Usually for that first week, you'll be on pain medication, so plan accordingly. If you have any chores, pets, or responsibilities, you are going to need some help. At home, you are able to shower. We do recommend showering daily with warm water. I would not recommend doing hot water just because that may dehydrate you. A regular soap, and making sure you're using a fresh towel and washcloth every time. So after you shower, put that washcloth and towel aside and get a fresh one. Now, this does not mean you can go swimming, no going in the jacuzzi or the ocean. You cannot be submerged in water, just showering to keep your incisions nice and clean. Try and keep them uncovered and open to air, and keep an eye out for redness or swelling. That is reason to check in with the surgeon, so make sure you're showering every day and checking your wounds every day. You will have a follow-up appointment with the surgeon's office, so make sure you schedule that with them directly. Again, our bariatric office is only going to direct you back to them. You can come to us for nutrition questions, but anything else, go to the surgeon. Remember, this is a lifelong journey, and we've already worked on so many of these topics. So having small, frequent meals, chewing up your food well, limiting your caffeine, carbonation, and straw use, eating when you're hungry but stopping when you're full, having a high protein diet, lower in fat, and lower on carbohydrates, exercising regularly, taking your vitamins and minerals, prioritizing fiber. These are all ways to get your most success after a procedure like this. Here are some examples of apps that you can use as opposed to the written log. So a pedometer app to track your steps, the Verytastic app has a lot of great resources, as well as maybe a water logging app, so you can look into these as well. Congratulations, you have made it to the end of the pre-operation class. Feel free to reach out to us if you have any additional questions, and we're wishing you the best of luck on your surgical process.